Alrighty, good morning guys. I'm Dr. Soleil Arrieta. Thank you so much for coming out to St. Elizabeth's. This morning we're going to talk about insomnia or sleep problems and what we can do about them, because a lot of us probably have trouble getting to sleep, maybe staying asleep, or probably are not waking up feeling fully refreshed. Go and get them, right? Although we wish we could. So we're going to talk about that. Insomnia means habitual sleeplessness, the inability to sleep. Now, this does not usually mean one bad night of not being able to sleep, tossing and turning. This tends to be an issue that is chronic, which means it's long going, and you've probably talked to a couple of people about this or have tried multiple things before. There are a couple different ways, like I said, an ability to fall asleep or stay asleep, and they can be treated in two different ways. Most commonly, the changes in our sleep are caused by what's happening or changing during the day. That could be changes to our daily routine. Maybe we're traveling, right? Jet lag is definitely going to throw off your sleep pattern. Sleeping in a new environment or even in a hotel is going to throw that off. If you are very sensitive to noise or light, 4th of July might not be the best holiday for you, right? You're trying to sleep and your neighbors are celebrating for 3 days on end. I swear mine do. And that's going to create some difficulty falling asleep if you're very sensitive to noise. Your eating and exercise habits, what you're doing, if you are shifting your work schedule, right? Some people that do shift work maybe are working day hours for 3 days, and then all of a sudden they're taking the graveyard shift and now have to be up all night, and then 3 days later they have to go back. That change in your daily routine is going to cause disruptions to your sleep. Sleeping problems can also be some of the first signs that we're also having underlying issues, maybe with depression or anxiety. And so a lot of these topics and slides I'm going to talk about will coincide with my lecture on depression and anxiety I just had a couple months ago. So this is a nice little infographic, if you will. Insomnia is definitely the most common sleep disorder in the U.S. 40 million Americans have trouble sleeping every year. And chronic insomnia is defined as 3 nights of trouble sleeping for longer than 3 months. So at least 3 nights a week for over 3 months. So that's chronic. And we definitely see this as a bigger problem in our women and our older generation. And we're going to talk a little bit about why. Sometimes it's hormones, sometimes it's neurotransmitters in the brain. As we get older, we need less sleep or we're not able to get into that deep sleep. But a lot of these will talk about difficulty returning to sleep, falling asleep, etc. So, what is sleep? And why is it even important, right? We sleep such a large amount of our day, if you can imagine, right? We're trying to sleep for at least 8 hours. Why do we need it? What is it good for? What is it doing? A lot of sleep, you're able to actually restore your brain, right? Memories are consolidated. So when you're in school or trying to learn something new, sleep is important so you can actually retain that information and use it. You can concentrate better, pay attention in your daily life, right? And maybe study and learn and pick up those things. You are at a better mental health and physical health if you're able to sleep. This is when your body is able to kind of take its time to relax and restore not only the brain cells, but heal the rest of the body too. So if we're young and let's say we're a football player, you're getting banged up on the field, it's good to take a step back and let your body heal, and that's kind of what sleep is as well. So if we're not sleeping, we're not able to let our healing happen in our brain or our body. Muscle repair and recovery and metabolism is regulated. So people that have sleeping problems often find they're going to have trouble regulating maybe their blood sugars or their weight. They're having trouble kind of getting up that get up and go, and so they're not exercising as well, which leads to more sleep problems, etc.
92 or 89, please call the hospital front desk. 92 or 89.
So that's why on the right side of the screen, you'll also see that if you don't get enough sleep, you're going to be more tired, anxious, depressed, trouble concentrating, etc. Everything that helps you sleep, if you're not getting that sleep, you're going to have issues with. So let's talk about the proper sleep-wake cycle, okay, and what that kind of looks like. It's we also describe as circadian rhythm, which is the natural kind of schedule your body wants to take. A lot of this has to do with your hormones throughout the day and night. And we have two hormones up here. The black line is cortisol, or your stress hormone. And the red one is melatonin, or your hormone to help you sleep. The body determines your internal cycle. And a lot of times, if it's, quote, regular, will look like this on the right. So let's say you wake up 6, 7 a.m. Around 7:30, your melatonin secretion stops, so you can wake up, right? The melatonin helps you sleep, so you need that to turn off. Your cortisol then turns up because you're ready to start the day. And then throughout the day, the cortisol kind of drops, and at night, the melatonin kind of comes up, right? And we continue our day. Melatonin secretion starts in the evening, deepest sleep around 2 a.m., and then you wake and you do the whole thing again. Now that's if it's working well. Sometimes things that we do in our daily life inhibits the circadian rhythm. A very common thing in our daily life is light. Now the light goes into the back of the eye and goes into our brain, and it tells the brain, hey, it's daytime, I cannot make melatonin, I need to be up. The problem is that we now are surrounded by artificial light. We have lights in all of our rooms and all of our houses, right? Everything's lit up. The screens, the blue light that are coming from the tablets and our computers and our TVs, all tell our brain it's still daytime. So the longer we have those on, our brain is not able to switch to night mode, and we never kind of are able to make our own melatonin. We're having trouble kind of settling down. Of course, if we're going from go, 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 light, 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 to all of a sudden dark, and you're supposed to be asleep in, what, 2 minutes? How is that going to happen, right? So a lot of the problems we see messing with our day-night cycle comes from the light. And that's why shift workers will also have trouble, right, going back and forth. Because maybe one day they're supposed to be up all night, and so they need that artificial light to kind of keep them stimulated, right? They have to work in a really well-lit, maybe factory or something. And then they suddenly switch it, they go home, and it's daylight, and the light is pouring through their room, but they're off, and they're supposed to be sleeping during the day. That's very, right? Can we see how that can cause a lot of trouble to our body? So blue light specifically, which comes in natural light, right? And you'll see a lot of these too when we talk about light box therapy. I mentioned in the depression and anxiety. Some of that light is beneficial, especially in the morning, right? Right now, if we're having trouble with depression, anxiety, getting up, energy, then maybe a light box would help because it tells our brain, hey, it's morning, it's daytime, let's go, like let's do it, let's have that energy, etc. What we want to make sure is that at an appropriate time, we take away all of that light so our body can naturally get ready to calm down and go to bed. Does that kind of make sense? So, how much sleep is enough? That is the age-old question, right? Now, if you're a newborn, I hope you're getting about 14, 17 hours, right? You're sleeping basically all day. You wake up, you cry, you get fed, you get cuddled, change your clothes because you made a mess, and then you go back to sleep, right? If that's not the life, I don't know what is. But as you see, as we get older, the need or recommended hours of sleep decreases. Basically, after the age of 18, our range is about 7 to 9 hours. Less as we get older. And the reason is because as we get older, we have more trouble getting down into deep sleep and staying there. And so, if we're not deeply asleep, we're now in light sleep, and it's easier to wake us up. So now maybe that noise or that light, that flash of lightning that just happened the other night, right, is waking us up, whereas 20 years ago we could have slept like the dead, right? And so now we're having more trouble because we're constantly being woken up out of our light sleep, and we're not getting the restorative deep sleep. Some people combat this by taking daytime naps, right? Does anyone in here take naps? Yes, aren't they amazing? I wish you could go back to kindergarten and be like, nap time. However, naps can inhibit you from sleeping later on, right? If you're sleeping too much during the day, then your body is getting the rest it needs and it's storing it in its sleep bank. And as nighttime comes, now you're just sitting there. And you're like, well, I slept half the day, so what do I do now, right? So be careful with naps. Now, if we are sleeping really well at night and we're getting up and we're doing something and we need a 20, 30-minute nap during the afternoon and it refreshes us and it picks us back up and we're still able to sleep at night, then your nap is not doing you any trouble, right? As long as you're feeling like you're getting adequate sleep, and the amount of adequate sleep is not actually by hours, but it's how you feel when you get up. You should be awakening feeling refreshed. Oh, that was amazing. That was great sleep. I'm ready to go, right? Most of us are not feeling like that. And so that's the goal. The goal is to sleep the right amount that our body, quote, needs. Some of us need a little bit longer, and that's why the young kids are maybe not getting their 10 hours, our teenagers, right? 10 hours of sleep during the school day. Are you kidding me? Or school night, right? They're up playing games, they're talking to their friends, whatever they're doing. But a lot of them will make up for it on the weekends, right? They're sleeping 12 hours a day. You poke them with a broom at 2 p.m. and ask them if they want lunch. But they're trying to catch up on the sleep that they have, quote, missed out on in the week. And sometimes we can be the same, right? If we're not getting enough, when we finally get a rest, we're going to be sleeping a little bit deeper, a little bit longer. But our need for restorative sleep goes down as we age. So, if I'm not getting the sleep that I need, why is that so bad? I can just caffeinate myself in the morning, right? They've come out with thousands of energy drinks, and there's a Starbucks on every corner, and I can just keep going and going. Well, sleep, if we're not allowing our body and our mind to sleep and restore itself, it creates some problems. And some of these are cognitive impairment. Sometimes we're not able to make those connections in our brains like we used to, and that can be because of sleep. Sometimes we have memory problems, right? Sometimes we're having impaired judgment because, again, we're not fully there. We haven't allowed our brain to rest. Some of these symptoms can be similar to ADHD symptoms, so it gets kind of confusing. But if we're not able to heal our bodies in sleep, it starts to degrade what's happening inside. Now we're getting more sick more frequently because our immune system is not able to repair itself. Now we're at higher risk of type 2 diabetes because, right, that's our pancreas right there, type 2 diabetes because if we're not helping our metabolism and we're constantly have a high cortisol level, right, which is the stress hormone that is high throughout the day to wake us up because we're not sleeping, then we have impaired blood sugars, right, which can lead to type 2 diabetes. We have decreased reaction time and accuracy. Some people will get achy joints, some people will get tremors. This can then lead to increased car accidents, right? If we're not sleeping well, we can't think the next morning, and our reaction times are now impaired. We have seen increased car accidents on the road due to a lack of sleep. So, medications that can sometimes make it hard to sleep. Some of these, if taken closer to bedtime, can cause trouble with sleeping. Now, that's not across the board. That's not for everyone. If you've been taking your thyroid medicine at night and your doctor says, yeah, that sounds good, and you don't have really a lot of sleeping problems, then that's totally fine. That works for you. And it's not all thyroid medicines, it's just some of them. Steroids, right? Because it's a hormone that kind of pumps everything up. You're going and going. Steroids like prednisone, right? For a short course of prednisone, let's say you need it and your doctor says, yes, you need this for 5 days, then that might make you a little bit more wired for 5 days, but you should then get over that, right? Because you removed the steroids or the prednisone and you're able to go back to normal sleep. Some of these, like your albuterol, your rescue inhaler. Your rescue inhaler is really good because it opens up your lungs. The problem is the side effect of the albuterol causes your heart rate to increase. So if you're having trouble sleeping, or you're coughing, or you're wheezing because of your asthma or your COPD, and you're taking more and more of that albuterol because it's not controlled, you can basically wind yourself up right before trying to lay down, and then you're in bed and you're like, whoa, 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 what's happening? Because your heart will not settle down and you cannot rest because basically of the albuterol. Usually you don't recognize this, obviously, throughout the day because you're going. You might notice, hey, that's a flutter, but you're taking your albuterol because you need it. If you're taking it all the time, and this is an issue, please talk to your provider about maybe, do I need another inhaler that is a longer lasting that helps to control it? But that's a whole other lecture, and I'll see you next year about it, okay? Amphetamines. Now, amphetamines can be, right, definitely street drug, meth, right, crystal, all that good stuff, it ramps you up. But sometimes it's also used to treat ADHD, right? So our young kids that are on ADHD medications can develop trouble sleeping because it helps them focus, right, throughout the day, but it does not allow them to calm down and go into restful sleep at night. So that can cause some issues. Substances that make it hard to sleep. Now, these are the 3 big ones. Tobacco or nicotine, alcohol, and caffeine. And all of these take a look in different parts. Now, caffeine is the easiest one to look at and be like, yeah, that makes sense, right? I drink my pot of coffee in the morning so I can get up and go. So if I'm drinking a pot of coffee at night, it makes sense that I'm not able to calm down and sleep. The trouble is that the more we drink caffeine, the more tolerant we become. So now we need more, right? And now we feel like, well, it's not affecting me like it used to, so now I need 8 cups instead of 2, right? And now you're in this whirlwind, and now you're drinking coffee until 5 p.m. at night, and you feel like, hey, it's fine, caffeine doesn't affect me, and then you have sleep problems, right? It's probably the caffeine. So weaning back on the caffeine is easy enough because you can just put a time limit and say, listen, I'll still have my coffee, but I'm going to stop it at 3 p.m., right? Don't have that 5 p.m. coffee because that might be the one that's tipping you over. Maybe stopping at 3 p.m. is the trick. So that's nice. That's an easy do it, right? Because then you can still have your favorite beverage, but you just cut it off a little bit earlier. Now, alcohol, most people think because alcohol is a sedative that it will help them sleep. The problem with alcohol is that you can sleep while on it, you just won't get to deep restorative sleep. So now you're stuck in that light sleep, right? And that's why you're waking up multiple times at night. When you just had a heavy, binge, you went out, you had a great time with your friends or a huge party, you had fun, you got maybe too much, and so you, quote, pass out, but you can wake up easily throughout that night, right? And then that next morning you feel like, oh, I feel like I slept for 9 hours, but I don't feel it inside, right? Because you're missing that deep restorative sleep. And then tobacco can definitely kind of wind things up a bit. Again, if we can pull back, and that's a whole other story, right? Quitting or cutting back on tobacco or nicotine products, but that can inhibit sleep as well. So, some medical conditions can make insomnia worse. Anxiety, panic disorders, or PTSD. That makes sense, right? If I'm anxious all the time, and I have anxiety disorder or panic, or I'm always revved up, it is going to be a lot harder for me to then relax and go to sleep. Same thing with the asthma, emphysema, COPD, and that's mostly because of that inhaler albuterol. Some of it is because we're having trouble breathing, right? And that can then go down into the second to last one, sleep apnea. If we're not breathing well, your body will continue to wake you up so it can stay alive and you breathe, right? With sleep apnea, you stop breathing for short periods of time, and then your body kind of jolts and wakes itself up. So of course you're not getting to that deep sleep because you're constantly being like basically jabbed to wake up all the time. So same kind of similar things. Depression, you might have trouble sleeping. Some people with depression have trouble sleeping too much. Central nervous system kind of goes in line with restless leg syndrome. Those with Parkinson's have trouble sleeping. Those with restless legs, right? You cannot stop moving. Periodic limb movement disorder. That makes it really hard to just relax and stay still. And so you're constantly kind of waking yourself up. We're going to talk about really good treatments for those. Pain, heart failure, substance abuse, all going to make it difficult to fall asleep. Because we're having trouble sleeping, we are not as productive, right, the next day. And this infographic says $411 billion were lost in U.S. money in 2016 because of lack of sleep. That's significant, right? That's inhibiting a lot of our economic growth, and it's inhibiting, obviously, a lot of us healing ourselves and getting that restful sleep that we need. 66% of the U.S., or 2/3 of adults, do not get the recommended amount, right? Your 7 to 9, I'm going to say an average 8 hours of sleep a night. And then if you drive a car and you've only had 4 hours of sleep the night before, you are 11.5 times more likely to be involved in an accident. That is significant and scary. So, what do we do about it, right? We now know that sleep is really important, and we all know we're having trouble doing it. So what are some take-home tips that we can talk about? So the integrative approach, we're going to definitely, your healthy lifestyle, right? Eating a little bit better, getting the nutrition your body needs, getting the exercise, regular exercise and diet can create basically an entire change in your lifestyle that you probably don't need a lot of these supplements or medications, and that it's huge. It allows your hormones to come into balance, right? We need lower cortisol levels so we're not constantly ramped up and stressed and anxious, and it's creating weight gain, etc. And we need to create the good environment so our brain can make its own melatonin, so when we're going down to sleep at night, we can do it so peacefully and easily, right? So those hormones need to come into balance. So we're going to talk about tips in the following slides. Now, the first tip I'm going to talk about before going into the next slides is do not do everything I'm going to list all at once. That would be chaotic and confusing and almost impossible, right? So choose maybe one or two that say, hey, I could do that starting tonight, right? And start with that. Make it super easy on yourself, and then you can add another one, right? So let's go for it. During the day, what are some things that we can do? Now, a lot of us cannot change the way we sleep just by ourselves. And we have this fabulous thing called cognitive behavioral therapy for insomnia, which is insomnia-related counseling. Some people will go and talk about, is it because I'm anxious? Is it because I'm stressed? Is it because I'm dealing with something else? What am I doing for my insomnia? And just talking to someone about their lack of sleep helps to give them coping mechanism, tips, tricks, and you can actually help yourself get to sleep without any other medication. So that's why my first plus. During the daytime, we have got to spend time outside in natural sunlight. Now, we are coming up on fall and winter. So that's where that light therapy kind of comes in, right? That light box therapy. The reason is because, if we remember to the first couple of slides, when we get that blue light or natural light into our eyes, which then kind of wakes up the brain, we're able to get energized throughout the day. If we are energized throughout the day, we are then able to sleep better at night. And that's why exercising daily also helps. Now, regular exercise, and it doesn't have to be, right, running a marathon. We're going to start nice and slow, but something just like walking. But walking every day is going to not only help you feel better, but increase your energy, which is interesting, right? Energy during the day, and then sleep better at night. And if you can sleep better at night, then you again have more energy during the day, you go for your walk, you feel good, and then you're able to sleep better at night. So it's that beautiful cycle which we're trying to create. It is very important to keep a regular routine bedtime, right? If I go to bed every night at 9 p.m. and I get up at 7 a.m., whatever those hours are, that sounds like a lot of sleep, that's 10 hours. But you stick to a bedtime, basically, right? It helps our kids, it's gonna help us. Every night at 9 p.m., I start to wind down, I turn off all the lights, I do my pre-bed routine. By 10 p.m., I'm trying to go to bed. So then at 6 a.m., 8 hours later, I'm waking up. And we're gonna keep that schedule regardless of what you're doing. If you go on vacation, I'd love to say, hey, keep that schedule. And the reason is because that routine helps your body know and redevelop its own circadian rhythm that says, hey, it's 7 a.m., I'm supposed to be awake, let's go do something. As opposed to if you're always changing, right, like those shift workers, and you're constantly trying to play with your wake time, your body doesn't know when it's supposed to be awake or not, and then you're trying to wake up and it's, time change, it gets confusing. So stick to a regular routine and it will really help your body. Now keep a sleep diary. On the back table, I've printed out sleep diaries. It is just for 1 week, and we're going to talk about it, I think it's my next slide. A sleep diary is very important to figure out where we're starting, right? What am I doing now to help me sleep? What time am I going to bed? What time am I waking up? What am I doing right before bed? Please tell me I'm not downing a pot of coffee, right? Or drinking tons of alcohol, or having a huge meal. That meal might keep you up at night. If you have heartburn and you're eating right before bed, that's going to create trouble, right? So, little things we need to start thinking about, and that's where the sleep diary comes in. Fresh foods. Now, all that kind of goes back to that lifestyle, right? That diet, exercise mentality, getting our nutrition, our whole nutrition from the foods is really going to help. And reducing stress. And I wish that was as easy as said as done, but go back to my previous lecture on stress that I did a couple months ago. Now at nighttime we are, instead of, right, during the day we're going out getting all that bright light, at night we're turning off all the lights. 1 hour before bedtime, we are going around the house and we're turning off all the overhead lights. And the reason is because overhead lights are very bright and have a lot of that blue tinge. I want you instead to turn on all the lamps. The lamps tend to be really low level, nice, orange kind of look, right? A little bit more dim. That's what we need an hour before bedtime. That is how our body is going to know, hey, now it's nighttime. I'm not getting that blue light constantly in my eyes. I need to start making my own melatonin. At the same time, an hour before bedtime, I want you to turn off all the TVs, tablets, computers, phones, all of that, because it all has that blue light that's going to tell your brain, hey, it's still daytime, let's still party, right? We don't need any of that when we're trying to sleep. So about an hour before, we're going to turn everything off. We're going to start reading by lamp, right? Start doing a puzzle. Start, whatever it is that you want to do, we need to start making a bedtime routine that starts an hour before bed. This is a good time to maybe take some supplements, drink some sleepy time tea, which we'll talk about in a little bit. But again, that's kind of what your complete bedtime routine looks like. They also make blue light blocking glasses, okay? However, if you turn off all the blue light sources, you do not need these glasses, right? That makes sense. However, they do make them. And then we're talking about a relaxing pre-bedtime routine, right? What does that look like? If that's reading, right, by the lamp, if that's taking a warm bath, an Epsom salt with some nice candles, if that's doing guided imagery, if that's doing relaxation exercises, maybe restorative bedtime yoga, nothing that's going to get you amped up. If you exercise about 2 hours before bed, it tends to turn things on, and so you don't want that. You want something nice and calming, right? Meditation, yoga, warm bath, all that good stuff. reiterating the fact that you're going to bed at the same time no matter what, right? So we start an alarm on our phone. Maybe it's 9 p.m. Ooh, I gotta start getting ready. Let's turn off all these lights, let's turn on the lamps, let's do this, I'm gonna change, I'm gonna take a bath, and whatever it is, you start at that time because your clock or your schedule told you to. By an hour later, you're in bed, you're ready to close your eyes and start this sleeping process. It is beneficial to keep your bedroom on the cool side. That's usually about 60 to 67 degrees Fahrenheit. And the reason is because studies show that the body gets more of that deep restorative sleep in a cooler environment. Now, that doesn't mean you have to sit there freezing in bed, right? You can still, your body, right? If you're cold, get cold hands and feet, put some socks on, put some mittens on, you can go to bed with it, all that good stuff. You can even treat yourself, maybe put on some paraffin wax or some lotion, then put the gloves on, and then in the morning you wake up and you're like, ooh la la. However, right? Write that down, that's a good advice. However, keeping the environment cool, right, is going to help your body kind of get into that deeper, more restorative sleep. Bedroom needs to be quiet unless you want a source of, quote, white noise. This does not mean the TV, right? The TV not only is giving you that blue light, but is actually speaking a language you understand, and you tend to get your attention, right, pulled away from you trying to sleep. So I don't want you to do any of that. It's a white noise. Is it a fan? Is it something? It's something there that you cannot really pay attention to or understand, so you can't get, right, distracted and trying to maybe get sucked into that one last TV show. But if you cannot sleep in pure silence, then a white noise machine might be for you. Darkness is also going to help, right? The darker it is, the more melatonin your brain can make. This also tells your body it's time for bed, right? So the darker the better. Use your bed only for sleep and sex. If you are tossing and turning, right, and you're sitting there for about 20 minutes and you're like, this is not going anywhere, I don't want you to sit there anymore. I want you to get up, read a book that is not stimulating, right? Don't read the next best murder mystery, okay? Because that's going to keep you engaged. Read something super boring. Read the Federalist Papers. I don't care what it is, right? But something that is just, oh, it's going to lull you back to sleep. Don't turn on bright lights, lamp only, okay? Once you feel like, okay, now I'm relaxed back again, get back into bed. Because bed is only for sleep and sex. Do not eat in bed, do not do homework in bed, do not do anything, right? So your body, again, it's creating those habits. I need to know that when I'm in bed, everything's cool, it's all dark, I'm ready to go to bed, it's now sleep time. Remove electrical devices from easy reach. Multiple reasons for this. If you get a text message at 2 in the morning, you are going to turn on your phone, and that is a face full of blue light, right? You are now suddenly awake. Now you have to respond to said text message, right? Or think about it at least, and now your brain is turned back on. So if you remove that from your bed, you no longer have that as a distraction, right? Remove the light, remove the sound source, turn it off. If you turn it on do not disturb mode, your alarm, if you use it as an alarm, will still work. Believe me, I do it every night. I sleep like a baby. Actually, we need another term because babies don't sleep that well, do they? Sometimes. So, keep electrical devices away from easy reach. Sleep aids for a good night's sleep. Get into a routine. Meditate. Drink lots of water. This is not before bedtime, right? If I drink a liter of water, it has to come out. Do not drink it at 10 p.m. because then you'll be like, Dr. Arrieta, and you'll be up all night, right? Shaking the angry fist because you have to pee it all out. Drink all of your water throughout the day and stop drinking, right, about 8, 9 p.m. So then you can have that last void right before bed, so then you're not waking up. Or you're less likely to wake up. Be aware of what you are eating. The more sugar, processed carbs, food are going to turn on that inflammation, increase anxiety, increase sleep problems, etc. You also need to be aware, especially if you are those suffering from heartburn, that a large meal might have trouble processing if you eat and then try and go to bed. Or if you eat a spicy meal, it's going to keep coming up and you're going to have pain, right? So just something to think about. Make sure that your room is dark and quiet while sleeping. Write down your worries, and a lot of that is about journaling. If we have anxiety and we're laying down to go to bed, and we are one of those that tend to think about all the 101 problems of the world, right? Sometimes it's easier just to put it on paper. If you put it down, you've already processed it, you've thought about it. Now you don't have to keep thinking about it, because what you're doing in your head is trying to remember all the things. What was that I had to worry about? Oh yeah, I had to worry about that, and then this, and then my neighbor's dog, and oh my gosh, I hope it gets better. That's not a time to worry about it, right? Journal those all away, write it all down, you've already processed it, and so you're going to be able to sleep a little bit better. Drink less caffeine, drink less alcohol, especially right before bedtime, right? Decrease tobacco, exercise regularly, get comfortable in bed. Your bed should be comfy, right? We're using it for those two things. It needs to be really nice. Maintain a sleep diary. We passed out those, and we're going to talk about those, the sleep diary and specifics in a couple slides. And then your aim is about 7 to 9 hours of sleep. If you keep a sleep diary, it's easy to know, hey, this is what time I, quote, went to bed, and then I maybe stayed to bed or awake for about 2 minutes. I kind of did my things. I was kind of doing my mental mindfulness exercises, whatnot, and then next thing I knew, my alarm was waking me up. That's perfect night, right? And then you write down in your sleep diary, oh, I woke up at 7 a.m., I felt like this, etc. Some of us who like to be maybe a little bit more technical, they make sleeping devices that will track your sleeping for you, okay? I wear a Fitbit because I'm obsessed with how well I'm sleeping at night. It attaches to me, and then it can tell how often I'm waking up, my heart rate, right? What stage of sleep, how long am I sleeping? I went to bed at 10, but I actually fell asleep at 10:15, you know, all those good things. However, if you're more analog, that's totally fine, right? We have that piece of paper for you. It totally works the same, but just know that there are options out there. So, we're going to remove these barriers to sleep. No stimulating activity right before bed, right? Do not get yourself excited. Do not chase your kids around and play captains or, you know, whatever, robbers, and obviously I don't have kids. So, build competitive games, exciting TV shows, right? Stimulating books. Don't have that important, oh my gosh, we need to have this discussion and it's 11 p.m. at night. That's not the time for it, right? You're just going to wind yourself up. Take it nice and easy. No caffeine, no alcohol. Avoid stimulating reading material. Keep the electronics away from the bed. If you have trouble sleeping, then we might need to stay away from your daytime naps. Those could be the answer for why we're not sleeping at night. Steer clear of medicine, supplements, or substances that can be difficult for you to get a good night's sleep. And this is the hardest. Do not command yourself to sleep or sit there worrying about if you're not sleeping. That in and of itself is going to keep you up at night, right? Again, it's one of those anxiety, those ideas. That's why sometimes people find it beneficial to write down their sleep or their dreams or their whatever, so they can just write it down, and now they don't have to worry about it. Because the paper knows everything I'm worried about, right? The paper knows everything, it keeps everything, no one else has to read it. So this is our sleep journal. In the morning, you're going to fill out the day of the week, maybe in the start date. What time of bed did I go to, what time did I go to bed last night? What time did I get out of bed this morning? Last night I fell asleep. Did you fall asleep? Is it kind of difficult? You know, those kind of things we're keeping track of. I wake up during the night. How many times? How long did you stay asleep for? You know, etc. Now, I'm hoping at the most it's to get up because I have to go pee, I go back to bed, and now I'm out, right? And I'm hoping that if we make some of these tweaks, it's at max, you know, 1, 2 times at night. Now, if you're one of those that are getting up 8 times at night, I want you to talk to your provider, right? Because maybe something else is going on, maybe we can tweak some meds, etc. My sleep was disturbed by last night I slept a total of blank amount of hours. When I wake up in the morning, I felt, did you feel fatigued? Like, oh, it's another day, I did not sleep well. Or did you, oh my gosh, I think I'm turning a corner. I'm feeling refreshed when I wake up. This is nice, this is a change. Write those all down. And the reason is because you're able to take this in, not only for your own knowledge, but your provider's knowledge, right? If I have a patient and they say I'm having trouble sleeping, we're going to talk about these things. I want information. And if we don't gather that data at home, we're not going to have information to talk about. And then at the end of the day, right, you're going to fill out the other side. Medication I took, did I exercise for at least 20 minutes, did I drink caffeine, what time did I stop drinking caffeine, how much did I have, etc. Healthy sleep habits. Sleep diary, right? We just went into that. Cognitive behavioral therapy for insomnia. We touched on that. Know that that's available out there. Melatonin. Now, melatonin is that natural hormone our brain will make if it's dark. Sometimes to kind of bridge the gap, right? Because we're trying to get to a point where we can sleep naturally without any aid. But sometimes in order to bridge that gap, we sometimes will take a supplement of that melatonin, right? Just to help us kind of get there. So that's over the counter. Music therapy, right? Again, with no lyrics, so you don't have to get involved and you don't have to pretend to sing along, but nice, soothing music, right? Instrumental can calm people down. Again, your bed, right? Make sure it's comfy, make sure you like it, make sure it's not the thing that's keeping you up at night. The bed itself, if it's old or the mattress is kind of wonky, will give you back pain and you can't get comfortable. So that's an easy enough switch, right? Know that the bed is only for sleep and sex, and if you're doing anything else in it, we got to remove ourselves, right? We're trying to create that nice habit and that routine. Guided imagery, biofeedback, healing touch, all of these are available. So when we're in bed, we can start doing them. Now some of them, like progressive relaxation, muscle relaxation, is basically just sitting there with your eyes closed, everything's already off and turned off and dark and everything. And as you kind of go down, maybe from top to toes, you are tensing up and relaxing all these different muscles, right? And you kind of concentrate it on let it go. And then everything kind of relaxes and you're letting go the day's stress. And you think about your shoulders and you go tight, 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 oh, relax. And then before you know it, some people are asleep before they reach their toes. So it's a nice kind of trick or recommendation that we can use. Same kind for guided imagery, right? If we're thinking about, oh, I'm standing by this nice cool stream, I'm relaxing, everything's totally fine. It's just another thing that we can use. Mindfulness, movement and exercise, right? Very important to get in the day, not within 2 hours of bedtime, because we don't need anything that's stimulating us, but this will help us sleep better at night. Some people use acupuncture, some people use traditional Chinese medicine, and some people use supplements. So we're going to talk about those a little bit. Supplements. Melatonin, very popular, but did you know there are 2 different types on the market? There's a regular type, and that works to help you to get to sleep. Then there's the extended release, which helps you stay asleep, right? So you could theoretically take a little of both. The regular melatonin, you'll take about an hour before bedtime, right? 9 p.m. your alarm goes off, you start turning things down, you start getting ready for your routine, you can take your melatonin. That's going to help you go to sleep at 10 p.m. The extended release you can take at the same time. The extended release, though, is coded so it doesn't release all at once. It releases slowly throughout the night. So it's constantly giving you a dose of melatonin as you sleep, so you stay asleep. That's really important for people that are constantly being woken up, right, in the middle of the night. You're going to take it about, an hour to 90 minutes prior to bed, and then give it a good 7 to 8 hours before you want to wake up, okay? My other favorite line is Bach Rescue. Now, they originally started with Bach Rescue Remedy, which I love for my anxiety patients, okay? It's really good. It's flower essences. You can take it with you. They have a whole extensive line. They then came out with this specific line of sleep. Now, there's a spray, and that's originally a tincture, so it's actually made, I think, with apple brandy, so tinctures all have alcohol in them. The alcohol is diffused off, right? But if you don't like that taste, you probably will not like that spray, okay? These other two are alcohol-free. This is similar to this, but they've made it into small little pills. You put it on your tongue, you let it dissolve, okay? Those flower essences calm the anxiety, help you get to sleep. This Rescue Plus, these are gummies, and this actually has all of these flower essences, but they have added melatonin in it. So just know that these are all available. Some of my favorites are tea. Now, I don't want you to go to bed drinking this tea, right? Because then we'll be up. I want you to drink this tea at 9 p.m. when your alarm goes off and we're starting our routine. So that will give us enough time for it to go through so you can go to the bathroom right before bed. But some of these on the market. The most common you might have heard of are these chamomile teas or chamomile. Okay, very nice, relaxing herbals, so they don't have any stimulants in them. Then these other ones over here are actually a collection of multiple herbs that all help you sleep. So some of them have hops, some of them have valerian root, some of them have lemon balm, right? So there's a nice collection. If you don't like one, you might like another, but there are multiple on the market, so that's nice. Some people like essential oils, right? Some people like to put them on, some people like to spray them. These are the essential oils that can help promote relaxation and sleep. The most popular being lavender, right? That kind of makes sense. Lavender is nice and soothing, helps you relax, help you sleep. Magnesium. Now, magnesium is my favorite because it's useful for all sorts of things, but especially here for relaxation and sleep. There are multiple different types of magnesium, so you have to be aware of the type you're looking for, right, and what's out there. Do not just walk into Walmart or CVS or even GNC and say, hey, I want a magnesium, because a lot of times they'll give you magnesium oxide, which is only good for constipation. And that's not going to help anyone sleep, right? So, my favorite is a type we carry here in our pharmacy is magnesium glycinate, okay? Now, magnesium glycinate is quite a large salt, so you'll actually need to take a couple of these capsules. This dose, particularly in pure encapsulations, if you choose to go get that, it's about 120 milligrams per capsule. The starting dose is close to 400, so you need to take 3 to equal 360, okay? Now, some people, if you're just taking it for sleep, can take them all together at night. Some people, if you need it for other things such as stress, anxiety, muscle relaxation, nerve pain, all sorts of other stuff, you can actually break it up and use it throughout the day because it's going to help. My other favorite is Epsom salts, right? This actually combines magnesium sulfate. You have to make sure it's actually Epsom salts. Turn the bag around and look at the ingredients. It needs to say magnesium sulfate and not just bath salts. Because what does that mean? I don't know. But I want it to say magnesium sulfate, because when you soak in the magnesium sulfate, you actually absorb it through the skin. It relaxes those muscles, nerve pain, right? Gets you ready for bedtime. The fact that they then mix it with lavender is just a nice extra, right? So now you've got a 2-for-1. You can take the magnesium and soak all on the same day. There's also magnesium-rich foods over here that I highly recommend. Again, we're trying to get our nutrition and get our body to where it needs to be just with lifestyle changes. I think that's the end of it. Now, I went pretty long, so I'm going to talk a little bit about these upcoming lectures, okay? Essential oils. Amy Sapola, the clinical pharmacist, is going to talk about them on October 10th here in this room at 9 a.m. I will then be back in November 14th. I'm going to talk about CBD oil. Ooh, yeah, that's going to be a good one. So tell all your friends, make sure to come early so you can get a seat close up, right? Because sometimes I have small writing. I then wanted to let you know I'm actually repeating some of my lectures at different locations. On Thursday, October 3rd, at Simple Abundance in Red Wing, I have not yet decided, I'm still talking to them, but they either want me to repeat my stress lecture or my depression and anxiety lecture. Either one, I think they're fabulous, but I'm biased. So come check it out, right, if you guys missed it. And then I'll be talking about chronic pain again at Lake City Library on Thursday, October 17th. Completely free for the public. Actually, Red Wing might be $5, but we'll check. As soon as we get more information, you guys should be seeing it in newspapers and other print. Otherwise, thank you guys so much for coming. Sweet dreams, and I'm available for questions.